This is the north of Syria, in an opposition-held region. Here in this displaced persons camp not far from the Turkish border, medical needs are huge and aid clearly lacking. MSF is working inside Syria, where it has opened 3 hospitals. The teams also supply drugs and train Syrians who give first aid to the wounded near the front line. Just a few months ago, these men had no medical knowledge whatsoever. During short visits, MSF emergency doctors demonstrate and explain basic but essential skills.
How to give oxygen, administer a simple transfusion, stop severe bleeding, apply a splint to a fracture, administer a first dose of antibiotics in the case of an open fracture, how to treat burns.
The majority of international humanitarian aid is being implemented from the capital city, Damascus, and distributed to areas under government control. As conditions worsen for some 7 million Syrians still living in opposition-held areas, international aid is minimal. In response to the needs in these zones, MSF is asking donors to also support cross-border humanitarian operations. We are in the west of Lebanon, in Bekaa Valley. Winter has set in and the Syrian refugees living here in tents and temporary shelters are battling with the cold. Their living conditions are very poor. Humanitarian aid is woefully inadequate and their health is in danger.
Water's coming out from the floor. It rained during the night, and in the morning I found this much water. I live here with my husband and his parents, and I'm currently 1 month pregnant. The cold isn't good for me.
According to the findings of a study conducted by MSF in May 2012, over half of the refugees are living in insalubrious shelter with no access to the healthcare they so badly need.
Due to the bad weather and the living conditions of the families with little heating, we're mostly witnessing lung infections and respiratory tract infections, which we provide medical care for. Lately, due to the very cold weather, most of the cases are children with high fever and infections. We're also seeing patients with asthma and allergy cases that are also identified and treated.
The MSF teams working in Tripoli and the Bekaa Valley are doing everything they can. They provide free healthcare and give out blankets and fuel so that people can keep warm. In spite of all this, the medical facilities are often overwhelmed. MSF continues to ramp up its activities in the country. MSF teams have remained in the north of the country throughout the crisis, including during the military offensive, in order to provide the local population with at least some access to healthcare. Medical and surgical care projects have been able to treat people wounded in the shelling in Timbuktu, Douenza and Ansongo, and a team arrived in Kona at the end of January.
On our first visit, we were a team of 4 doctors and nurses, and we had medical kits so that we could treat people.
MSF has been running operations in the north of Mali since January 2012 and has been working in the paediatric, surgical and obstetric departments at the hospital in Timbuktu.
In the past few weeks, MSF has treated 35 wounded patients in Timbuktu. In response to the number of people fleeing the conflict, MSF is also running programs in refugee camps in Mauritania, Niger and Burkina Faso.
We are treating this child as quickly as we can to try and save her. She is severely dehydrated and in shock.
Dr. Gilles Coupeau and his team are in a real race against time. MSF has been treating patients in the facilities that it supports since the start of the measles epidemic last October. But patients, often from remote communities, arrive at the hospital when it is already very late.
To respond to a measles epidemic, uncomplicated and severe cases need to be treated and preventative actions implemented, immunisation being the most important. We need to be able to treat patients as early on as we can. They don't get treated quickly enough. When serious cases arrive at the hospital, we don't have the life-saving drugs we need to treat seriously ill children.
The health system does not have the means to tackle the emergency. Healthcare services are all too rare and patients are unable to pay for them. Given the size of the area that is affected and the remoteness of its inhabitants, MSF has deployed major logistical support to treat 16,000 patients and vaccinate close to 340,000 children. So long as the epidemic prevails, the teams will be on hand to provide assistance. Every morning, Dr. Banza Poppy would visit this hospital in Kajokeji, not far from the border with Uganda. MSF's mobile sleeping sickness team was temporarily based here, screening for cases of sleeping sickness and providing a 10-day treatment to those in need. Much of the work in the battle against the disease took place far from the hospital, in remote villages where patients have little access to care. Over a 10-week period, the small team met the logistical challenge of transporting the mobile laboratory from village to village throughout the county. In the end, they tested 37,000 people.
Once you find the disease, that you can treat it easily with a few pills. So it means you have to take a doctor, win nurses, and you have to create a temporary hospital or join a hospital, and you have to administer these injections over a period of 10 days. So when you're really in remote rural places, it's not particularly easy.
It is clear that new and more effective diagnostic tools and drugs are urgently needed to help eliminate sleeping sickness. In Kajokeji it is under control, but the battle is far from over. MSF is continuing its work with health authorities to target other areas in the country where active transmission is still being reported or is highly suspected. These Afghans arrived here after a very long trek. In Helmand province, healthcare facilities are few and far between. To get to Boost Hospital, people have to travel many kilometres along dangerous roads, often littered with landmines, and go through several checkpoints.
Unfortunately, the patient coming in, they are coming to the Boost Hospital in very critical situations at the end stage of life. Whenever the patient gets any disease at home, so the father, they cannot go because they're afraid on the way that the bomb will blast, and sometimes mostly in the district there is fighting, so they cannot come to the hospital on time.
The biggest challenge facing the teams is to reduce the mortality rate of patients arriving in a critical condition at the hospital. MSF staff work in the hospital's surgical, obstetric, paediatric and emergency departments and treat over 1,200 people every month.